Flex your business with an American Express Business Gold Card. You'll earn 4 times membership rewards points on your top 2 eligible spending categories, like transit and electronics, each month, on up to $150K in combined purchases per year. Plus, you can now earn 3 times membership rewards points on flights and prepaid hotels booked on AmexTravel.com. Terms and points cap apply. Learn more at americanexpress.com/business-gold. Amex Business Gold, built for business by American Express.
Every cup of Nespresso coffee is an invitation to transform your morning routine into a ritual you can treasure each and every day. Using the Virtuo Pop, a simple touch of the button freshly brews bold aromas and a rich, velvety crema layer for delicious cafe-quality coffee at home. Whether you enjoy your coffee hot or over ice, every sip, every morning is unforgettable. Nothing tastes like Nespresso coffee. Visit Nespresso.com or our app to explore our full range of easy-to-use machines and coffees not found anywhere else.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode.
All right. Hi, Jenny. So everyone, I have a really fun guest today. I'm bringing on another person from my office. I'm very excited to have Jenny here. She's one of our great team members, and we're going to kind of dive into her personal journey as a dental hygienist, but now she also serves as a myofunctional therapist at our office. So what does all that mean? How has she gotten to where she is, and kind of what advice does she have to share? So Jenny, do you want to just introduce yourself a little bit, kind of tell us who you are as a person and what you're involved in?
Yes, Dr. Haley. First of all, thank you so much for even thinking about me to be on this podcast. I'm excited to share my journey, and man, you're a rock star. Look at you. You moved right up into the restorative main doctor in our office. That's huge. And you've only been working here for like 8 months.
I know.
I love it.
I appreciate
We're
it.
so lucky to have you.
Thank you. I mean, it's mutual. So happy every day here being with you guys. So
I'm glad. Well, yes, I have been working here at Centerville for actually this month will mark my 13th year. I had been hired by the previous dentist, Dr. Shields, and I really came here on a subbing job initially. So I started working here about 2 days a week, filling in for a girl that was on a long-term medical leave. And at the time in my life, I had 3 young children, ages 4, 2, and a baby. And I really wasn't looking for work, so the job kind of just fell in my lap. I was a stay-at-home mom, and the office honestly was really overwhelming to me. It had a lot of high technology. They expected a lot as a hygienist from you, and it was quite overwhelming. But after the medical leave had gone by, I had been working here for about 3 months, and so I was used to it by then, and I got offered a job, a full-time position. I had worked 3 days a week they were offering me, and so I took it, and I've been here ever since.
Wow. So at the time when you were looking to kind of do the subbing gig, did you guys just kind of wanted like some time out of the house, or were you looking to make a little extra money? Like, what kind of brought you back into clinical?
Oh, I'm always looking to make extra money.
Right?
I'm a spender.
I get that.
And yeah, I was looking to get outside of the house. I mean, the mom role is the most important role that you will ever come across. Raising little children is just a miracle in itself. And I don't take that lightly, but I also love people, and I love the conversations that you can bring, and you can enrich someone else's life. And I just really was hungry for something other than what was going inside my house. So yes, I did take it on to get some more money. And then also I wanted to use the career that I chose specifically because I chose this career because I wanted to be an amazing mom, and I knew I wanted to have a lot of kids early on in my life, and I wanted something that was flexible and that I could make a lot of money. And man, hygienists make a lot of money.
Yeah.
So I just felt like I needed to use what I had gone to school for.
Yeah, and you came from a big family too, so you always knew you wanted a big family.
Yes, I'm the oldest of 9 kids, so I don't share that lightly. You got to have thick skin to live in a family that has 9 kids.
Yeah, And over the years you've been here, you've added to your family. So you're still a very active mom. You still have young kids.
Yes.
How is that?
It can be very challenging. I feel that I'm kind of well-rounded on all parts. Not that I know of, my kids haven't shared like, oh my goodness, my mom is always focusing or talking about work, or I don't think my work family ever complains that all I do is talk about my home life or my troubles. So I think I really am a well-rounded woman, and I keep it like one life. Like I just do what I need to do at work, and also I do what I do at home. Mm-hmm. And I also blend in what I do as a myofunctional therapist in my home with my family. Yeah. So we always talk about airway. My kids are well-rounded about mouth breathing and dysfunctions. I think that they are knowing what I'm looking for. So they'll just like, oh, Mom, did you see that girl? Her mouth was hanging. I'm like, oh, not sure if I instilled those kinds of things that are with them growing up, or maybe they're just looking at it differently than I do.
That's so cool, though, to have a mom like you. You're so wonderful. And I mean, they learn so much from you about, proper development that most people don't have the background or training in that too. So that's like only going to benefit them. And you're able to, with your youngest now, like be even more aware because you've grown so much in your knowledge to really give all your kids kind of the best development that they can, which is all a mom really wants, right?
Yes. Yes.
Back when you decided you wanted to be a hygienist, were you early in like coming out of high school and then you went right into the hygiene track, or when did you decide you wanted to be a hygienist?
That's a good question. So I started in taking prerequisites for nursing. And my mom's a nurse, my aunt's a nurse. There's several people in my family that, kind of inspired me. And to be honest, school was tough for me. I didn't put much effort towards it. I also didn't do anything extra for school. Like I just got by, and I was okay with that. So when it came for graduation, I really didn't know what I wanted to do. Everything was a possibility. And so I did start taking prerequisites for nursing. And through that journey, I was like, I don't want to wipe any buttholes. Mm-hmm. So I'm not going to do that. And I don't want to help people get dressed.
Yeah.
So I kind of switched up my focus and was thinking about doing some dental hygiene. And I actually babysat that specific summer. I babysat for a woman hygienist, and she had 3 kids. And she was such a happy woman, and she paid me amazing for babysitting her 3 kids. And I'm like, you know what? I think I want to do what she does. She barely works, and she makes a lot of money, and she's beautiful and has good posture. And I think that's what I want to do. Right. And so really that woman, her name was Marsha, she inspired me. And from there, I started the journey as kind of retracking. It wasn't that much of a different track, but, mm-hmm. And then you had to apply based on, back then, it didn't really have to go about with your GPA. It was just like first come, first serve on who applied, and then you had an interview process. And so that's how I got into it.
Yeah, and I feel like for you, it's almost more full circle now because your daughter's pursuing hygiene. So it's like some wonderful woman inspired you, and now you've inspired your daughter. And like that's just going to like continue, which is really, really awesome because it is a great profession. And I feel like a dental office would not be good without our hygiene team. Like they're so essential, especially here. You guys do just like the most incredible job with everything. And I mean, I don't know, I couldn't imagine a day without you specifically and our whole team. So it's really, really a big impact there.
What makes this office amazing? And I can say that because I have, in the time that I had stayed home with my kids, I had subbed in several dental offices. And it is so wild on how dentistry is just done differently with different providers. I mean, there's no 2 providers alike. And you know that. We have 4 doctors that work here, and they all practice dentistry different, in my opinion. Mm-hmm. And so I knew what I was looking for. And the culture when I came in here originally, it was good. Good people and So, all around, I liked what I did. I liked the dentist. I liked what they expected of you. And they kind of gave you the autonomy to be who you are. And there is no greater love to love somebody for who they are and let them be, and they let you be who you want to be. And I think the culture has kind of transitioned to that, especially with the Thorpes owning it and Dr. Bono. I just think that it's, the growth is endless here. That's not everywhere.
Exactly. Kind of speaking on that, I know sometimes you go and you sub in other offices still just kind of to see what's out there. Did you also work somewhere else before you took on the sub role here?
Yes. So I had worked at 2 previous dental offices, both in Indiana. My very first job, I only worked 1 day a week, and I got the job through one of my fellow classmates, and she talked highly of me. And so I worked 1 day a week. It was an hour from my house. I drove, Tuesdays an hour, and I had the young kids still, 2 young kids. And you're working there, and then you always think the grass is greener on the other side. And another opportunity came up, and it was more days and a couple extra bucks more an hour. So I chose to go there. And that was an interesting office. That was funded by the state of Indiana based on grants, and it was straight in the heart of Amish country. So the clinic worked as like an insurance where families would pay a certain amount of money to come to the dental clinic, and you would just get all the dental care you needed for your whole family. And I worked as a hygienist there, but when the pretty significant recession happened in 2008, 2009, I had been the newest hired, so I was the first to be laid off. And I did not take that lightly. That was very defeating to me. And so for that to be I'd be the first to be laid off from that position, I'm like, oh my word. I'm like, the career that I chose to do and that I love, I'm already feeling like I'm not worthy, And I don't think it meant failure. And I know that now. Every time something doesn't go your way or the choices you make didn't go as you had hoped, I think it's data, like a data point, and you can use it to take it and grow. And I did. And I'm better because of all that.
So early in your career too, so young, that really does make such a big impact on you. It's probably so defeating, like you said. Is there anything thinking back that you feel kind of helped pull you out of it? Or did you just, keep going? You looked for the next thing and you just pressed through and eventually got over it?
Yeah, the temporary subbing jobs really did help. They also supplied people that were in heavy demand of, I need a hygienist. I can't move all these patients. Where are they going to go? That in itself, I felt needed, and I liked that feeling. And so that kept me moving. And through the subbing jobs too, it was an opportunity to kind of flex different talking points and skills depending on really how the dentist ran their office. And I learned a ton.
I'm sure. I'm curious too, because you were touching on the point, here we have 4 different doctors now. And like you said, everyone kind of has their different focus. So that's what their eyes go to when they look at someone, is usually the things they like to treat and the things they like to do. And then also just different philosophies. So how is that from your perspective, working with all of us?
Well, I would have to say it's different. I almost know you guys well enough to know, if I'm bringing you into an examination, I kind of figure out what you're going to talk about. If I have Dr. Libby coming in, I better have all this stuff in line because I know she is going to look at some specific things and I need to know the answer. It's just different per person, and I can read body language like a map. I think I'm really good at that with people, and so I can kind of sense I have my stuff together. And
that's funny. Yeah, we're eventually, as in the office, we're working on setting up a CE course for this personality assessment thing that we'll all take, and then we'll also get a report of I'll get a report with each team member and each doctor, like how I can best interact with them, and then also a bunch of data about yourself. So everyone will get that, which will be really cool. But I bet you're like, even at the course, because I went to it and then I was like, oh, I want to bring this here. I wrote down everyone's name and I was like, I think they are going to get these different like results, like just from my 8 months here of knowing you guys. So I'm so interested to see if what I think is going to be right. But it also is probably going to be so cool for you from that like clinical lens, because you'd be like, oh, like I totally know Dr. Bono's this way, and like this is why he treatment plans kind of this way. Or even the patient perspective, like you know the personality or the vibe that patient's giving off, and you probably know which doctor is going to get through them the best and kind of get them further along too, from getting to know us and then getting to know the patients, I bet. So I think it could be good to kind of transition to the myo topic. So we've talked a lot about like what you love about hygiene, but did there come a point that you were like, I want something more, or what brought your interest into myotherapy?
So I originally heard and took a patient through myofunctional therapy in my college of study at Kalamazoo Valley Community College. They are the only college that I know of to this day that still incorporates a myofunctional program in teaching their hygiene students. So I knew about myofunctional therapy. I studied it and tested on it, 20 years ago. And randomly, one evening, I went to a continuing education course in Indiana with Dr. Clower. He is a leader in the airway industry. And at his course, it was like a 2-hour after work course. There was a video of a mom videoing her sleeping child at age like 4. And the video was just way eye-opening for me as a mom and as a provider, because you don't often think about your sleep, and it's a third of your life, a third. Mm-hmm. And if it's not going good, you're going to feel like crap. And the video showed the little girl literally suffocating while her mom is videoing her, and you could see the struggle, like 40 seconds of not breathing in the video. And I was like, immediately that night, I'm like going into all my kids' rooms and checking how they're breathing, and literally every one of their mouths were open. And I'm like, what? I never knew this. And so after that course, I happened to stay a little later, and I talked to Dr. Clower's myofunctional therapist, and she was so sweet and helpful, and she said I could come anytime and shadow her, and I did. And then just after that, I was like way hooked into it. I'm like, now I can't unsee what I know. So I started investigating like how I could practice that in our dentistry. And Dr. Chad was just getting into airway and airway health. And so we kind of thought about it would complement all of his TMJ patients, and we could start there. So we did. And so I had a few patients. And then after it was, the ball started rolling, I decided to get certified. And that's when you research and you kind of pick what certification course you want to go through. And that is really how it started.
This episode is brought to you by State Farm. From your morning podcast to your afternoon playlist, State Farm knows you personalize your entire day. And that's why State Farm helps you personalize your insurance with the State Farm Personal Price Plan. It offers coverage options that help protect what you care about most at an affordable price just for you. Like a good neighbor, State Farm is there. Prices vary by state. Options selected by customer. Availability and eligibility may vary.
So good, so good, so good.
Great brands, great prices. Everyone's got a reason to rack.
Because they have framed jeans.
Nike? Yes.
Just so many good brands.
Vince, Kurt Geiger London, Rag & Bone, and more are at Nordstrom Rack stores now. You never know what you'll find, but you know it's going to be so good. Great brands, great prices. That's why you rack.
Yes. Choosing a course, I'm sure they all kind of have slightly different like philosophies of the therapy, but what does that look like to get certified? Like, were you having to physically go to courses? Was it mostly virtual? How many hours was it? Like, what was that process?
The process was a long, 4-day course. I believe it was 28 hours. And I think most of the introductory courses for myofunctional therapy still are around that many credit hours. And I traveled to Boca Raton, Florida, and took the 4-day course. And, you know, as a mom, and you don't really hear about traveling in dentistry, especially as a hygienist. And I was like, what? 5 days of travel with no kids in Florida? I was living the dream life.
Right.
So I was like, ooh, I like this. And the course was so overwhelming. So I had all this knowledge. I mean, 4 8-hour days of almost like a new career. Like you're learning this and you're just like, whoa, you didn't even know where to start. But good news, I had already kind of dipped my toes in it with our own patients and started looking and screening for some of these red flags here in our office. So I felt like ahead of the game of most of the introductory students that were attending these courses. And even in that beginning course, the instructor had asked me to get up in front of the student body. Then I can't believe I didn't know anything. And she wanted me to share my experience with getting my nose fixed because I had had nasal surgery. And I felt like in the course, you know, they were talking about nasal breathing, but they didn't really specify how to get the nose open. And so I wanted to make it more clear on it needs to be open, otherwise the tongue would never be habituated if we never establish nasal breathing. And so that kind of got the ball rolling on some of the impacting things that I love to do through myofunctional therapy, which is the teaching part and the patient connection.
Yeah. Wow. And I know your passion for it's just like oozing off of you, which is so great. And I mean, how you were saying KVCC teaches like a myo component. We literally that was not mentioned in our whole 4 years at dental school, in a school that's supposed to be like one of the best schools. So it's just such a shame. And then coming here, learning about it's just been so eye-opening. And exactly like you said, like your kids notice other kids now. Like my family members, little cousins, just people around. I'm like, oh my gosh, like I wish they could get in and see someone to help with their development. And people don't know. And even you said you went home, you went and looked in your own kid's room and you're like, oh my gosh, like they're mouth breathing. Like people don't know what they don't know. I mean, you have so many lives you're impacting through doing this, and then so many opportunities, because pretty much every person is developed poorly in some way. It seems almost every kid and adult, just like with our society and our poor nutrition and all of those things. So everyone kind of needs some variation of this, but people don't know about it.
I know. And that's like my passion. I love talking about it. I love talking about it in the grocery store or just sitting at a bar drinking a cocktail. Someone's like, oh, what do you do for a living? Oh, I can straighten teeth without braces. What? Like, no, I'm not kidding you. And then it's like a whole snowball of these guys are intrigued. Like just that statement, they're like, wait, what do you do? And when I first started doing that, was nobody heard of it. And I got a lot of slack with talking about it. You know, that's voodoo, or it's not going to do any difference. And man, the learning process can be very overwhelming, but the results and the life-changing health benefits of just establishing nasal breathing in itself is really what life's all about. Yeah. It's your first breath and it's your last breath.
That's true.
And
honestly,
all of it in between determines how many breaths you're actually going to have in your life. You know, if you do it well, you're going to live a long life. If you do it really poorly, it's going to create tons and tons of snowball health problems for you.
Mm-hmm. I mean, and being here, myself as the patient have realized how many problems I have with my breathing, and I'm trying to take initiative and work on that. But it's tough for people, yeah, because it's consistently coming in and committing to the program is hard for people, I feel like. What are some of the struggles you see with myofunctional therapy and with people going through the program?
Yeah, the struggles are hands down the compliance. You have a kiddo and their parents want the best for the kiddo. And of course, every parent wants their kid to be healthy. They sign their child up for myofunctional functional orthodontics and we're halfway in. It's 6 months in and we're seeing zero progress. And it's always, I feel like I'm a guide. Every time they come and see me, I'm a guide. I'm a guide to help them I'm meeting them where they're at. I just want to uplift them to the next step. And it's really tricky with people, the kids that don't want to be there. You can tell in their body language, you can tell in their cooperation, just everything. And so I'm a person that's outside the box. I'm very bold, and I will say it's okay if you don't want to be here. It's okay. But your body wants you to because you don't feel good. You're getting headaches every day, horrible sleep. You're always tired. This is what we're trying to fix. But you also have to put in the work to see the results. It's therapy. We don't have a crystal ball. Can't see in the future. And we can't see how you would be if you didn't do anything. So it's such a tricky fine line. And I think that's the struggle for me as a therapist, and also the constant reminder of why they're there. And you're re-educating them every time they come in, which also is a good thing. But as the repetitive motion, sometimes it gets you down if you have, several cases in a row that you're like, man, what am I missing as a therapist? And I try. I'm a happy, energetic person, usually. And so I try to incorporate different things and get them engaged different ways. I'm very creative. So it can be very tricky with the compliance aspect. And then also any type of roadblocks or obstructions. So sometimes we're halfway in therapy, we still haven't established nasal breathing. That's where we can say, hey, look, we might need to grab another teammate for the care of your team, which is maybe a specialist, an ears, nose, and throat doctor, to figure out why after 6 months, we still cannot get you breathing well through your nose. There could be another medical component to this that we're overlooking. So there are just some things that, when kids sign up for therapy, you're kind of growing the kid for anywhere between 1 year to 2 years. So you're spending a lot of time with the families and you see them often. So when things aren't going well, and they self-report too.
And for people that are kind of curious, so hygienist, myofunctional therapist, how is the schedule broken down of what your hygiene role is, what your myo role is? And you do a lot of our new patient exams. Sometimes those include hygiene, sometimes those don't. So what does your kind of flow of schedule look like? And I guess, what are some of the things that you enjoy about it and some of the challenges?
It's a good question.
A big question, I know.
So I've been doing myofunctional therapy for 6 years. In that time, we've tried a lot of different things. A lot. When I first did this, we only put myo on my schedule. And then there was a lot of wasted time in between progresses and things. And then we started putting in same-day treatment. So say you saw a new patient and they wanted their hygiene, then the hygiene would just automatically go into where the spaces were between my myo patients. And then we tried doing our value-based scheduling, where I did a couple exams in the morning and then all the afternoons was progresses. And so I guess what I've learned with the schedule is my time's my time. I'm here for the amount of time that I am. Whatever I can see and whoever I can help, put in the schedule. In my position right now, I love what I do. I love the autonomy of seeing new patients. I like the hygiene. I really do like it all. There's not something that I'm I don't want to see them anymore, There's always a benefit and something valuable to bring to my patient's life. And hey, they always inspire me and enrich my life too. So I think that while I'm here, I'm going to see whoever I can see. Sometimes it's tricky because then the myo people sometimes get pushed a little bit farther out because it tends to get filled up with hygiene a little bit more faster these days. But I haven't heard any complaints, so I think it's running very well.
Good.
Also, we have switched main doctor providers that I've been working with. I used to solely work with Dr. Chad a lot in the airway, and it's been about a year since Dr. Libby has kind of taken the lead on the airway health too. So, like I said earlier, every provider is different in how they practice, and it can be challenging for me. Sometimes I feel like I'm in the middle and I just stay the course, stay the course.
Yeah. I mean, I know you've said you're bold, you're creative, but you're also very adaptable. For all of these things we've listed off over the years, like this changed and that changed, and then we did it this way, and then we did it that way, and they've all been good and bad in their own ways. Like that's such a skill set too, to just be able to find the positivity in a new situation and try to make the most of it too.
So true. If you show up, smile and show love, be happy and inspire someone and work on yourself every single day. I mean, others don't need to change. You do. It's me. So I think just being a self-check in my mindset will get me a long way.
Yeah. So I'm curious too about specifically the new patient exams, because I feel like you do such a great job with those. And I mean, we have people coming in from all different levels of interest in their dental plan. Some people are here because someone made the appointment for them. They just want a cleaning. They have really no background in any dental knowledge. They might have a lot of problems and don't know it, especially because we look at more than just teeth. And then you have people that come in, I know you do this. I really want to get started with all this treatment. Like I'm really gung-ho. How do you engage with patients? How do you kind of get them further along depending on like their resistance and things? Because you do such a great job with communication. So do you have any like tips for that?
So one thing I've noticed is I tend to smile a lot, especially if the conversation is getting a little bit hairy. Also, I continue to ask questions, keep asking questions after questions, and things that are not yes and no, like open-ended things that they may not know, then they're more wanting or able to listen to what you have to say because they don't know.
Yeah.
Come to find out, they don't know.
Yeah, kind of try to catch them in something of like, oh yeah, I guess I've never really heard anything about how sleep is related to my breathing. Like if you get them to kind of call out what they do and don't know from what you were asking them, then they're kind of forced to like at least listen to what you have to say about it.
Yeah. I mean, dentistry for decades has been focused on cleanings, alignment of the teeth, and cavities. I mean, that's basic dentistry. And if people could just understand that oral health begins with the breath, and the breath really drives everything in dentistry and everything in the body. It's crazy and wild. If you just sit back and think about that for a second, you could come up with 100 questions just by their medical history. And that's how I feel that I'm so gifted, is with conversation, the body language, kind of feeling out the patient. And I'm a people person. So people tend to gravitate towards me because I'm easy conversationist. They like feeling good when they see me. Lots of compliments. You find something to compliment them on. The biggest gift I get is I go home and like, oh, I know I touched that patient today because they said something to me, or I saw their face light up in the conversation. Like the light bulb went on and I got through to them. And that is what I'm like trying to strive for every day, is somebody to understand it and get it.
Yeah, and you do. I think multiple times a day. Like you said, it's a talent and it's a passion, and it's like a snowball effect of the more you push yourself as a person to improve those communication skills and improve those abilities to connect with people, the better you get at it, the more impact you have, the happier you are, the more you love doing it, and it just keeps snowballing and growing, and that's why you love what you do.
Dr. Haley, 100%.
Yeah. I'm curious too, a slightly different question, but since you've gone through kind of being in a few different offices, and you've also been here a long time, we've had new team members join and stick around. We've had team members come and go. So for someone that's new in an office, whether that be an assistant, a hygienist, admin team, doctor, what advice would you have for someone to like connect well with their office and like how to, put themselves out there, like you were saying, be yourself, show your strengths and try to make a positive impact. But you also want to like feel things out. So like, how would you give someone advice if they were new in an office?
I would say any chance you get, look at what your coworkers are doing, shadow them, observe every type of appointment, look at how the health advocates and the treatment coordinators are dealing with the monies. Look how they talk to people. Observe your neighbor next door answering a phone call, and just use language that's open-ended and happy and positive, and the tone and the inflection in your voice also matters. I think it's a huge added. Communication really is the biggest drive. I think the more you're able to communicate well and efficiently is going to make all the difference. The patients here are coming to see you. You have impacted their life, and they're not your patients. They're Centerville's patients, but you are part of that amazing team. And I think us as a whole is just, the dream team. We're out there.
Yeah.
I don't think anyone in Southwest Michigan even comes close to what we do.
Yeah, I know. I get questions sometimes like, oh, why, how did you find that office? Why'd you pick that office? It's so hard to put into just a few sentences, but I'm just because it's the best. How could I was so lucky there was an opportunity there. We do things differently. We do things extremely well, and we get people further along in their health than I think a lot of other offices do, whether they're not looking for everything or they're not able to connect and motivate people as much as a lot of our team can.
Yes, I agree.
Another thing I was talking about with one of our assistants today, Amber, was we're we had kind of a long day today, and how, we are only open 3.5 days, and some of us work 2 days, 3 days. People will say, oh, you work part-time, oh, it must be nice. Yes, we have days we're home with our family, but we were both saying we feel when we're here, we are so on and we work hard. When we're here, we're working hard and we're as successful as other offices that are open 5-6 days a week. So that's saying something that maybe we're just putting in more work when we're here. So I don't know if you've ever experienced a bit of burnout from anything here, or if you have any thoughts about that, because I just thought it was an interesting kind of opinion that we came to. We're no, we work full-time, but in 3 days.
Yeah. We do so much extra here in this office that, time to time, there are days where you come and you're yeah, man, I still have all this junk I'm thinking about. I'm not ready for this day that I have 12 patients on my schedule, which I normally have 8. That mindset, I think, is you as a person. Your mind is not what you need to be. You need to be focusing on who you're going to see and be a little prepared on what they're coming in for. I would say for myself, yes, I have been. There's been,
of course.
I worked here for 13 years. I've had 2 children while I've been employed here, and that in itself is another story. But, you never come. It's crazy, but when you're gone for 3 or 4 months, let's just say on a maternity leave, it's why do they even need me? I've been gone for 3 or 4 months. Am I needed? Yeah. You get that feeling. And so then when you come back from that, you're la la. It's just you're doing the motions, but your heart wasn't into it. And that's how I felt I was last year. And I'm better now. You just get in a rut, sometimes I don't feel like I'm making a difference, or I'm just doing what I need to do so that I can go back home and deal with my home life. So it can be tricky, but not often do I feel like that.
And you talked to me a little bit about how one of the things that helps kind of get you out of a funky mindset is a lot of times your husband, and he's really supportive and kind of helps you reframe your thoughts. But is there anything else that you do if you feel like you're going down kind of a dark path and your just mindset is not right?
I would have to say I really focus on my actual breathing and my breath work. I think that being in the moment and listening to your own self breathing is enough. Just to breathe. Everyone can live a happy, healthy, enjoyed. Your life should be fully enjoyed just by being, you're alive. What else do you need? So if you just take a second back and think about what I'm preaching to all my patients all day, every day, I'm in a good spot.
Yeah, it kind of gets gratitude going again.
Yeah.
Fix
Dude,
things.
just calm down and get back to the basics, breathing.
Right. What advice would you have for working moms and people in dentistry that have families?
Man, I am probably the wrong person to ask about this. I'm a fly by the seat of my pants woman. I've never filled out a list in my life. I don't run a calendar. My life is chaotic. I'm sure if anyone ever came to my house, they'd be like, wow. But, it works for me. And I think everybody's different. And my kids are happy and healthy. And what more can you ask for? They're successful. I have one in college, one that's a senior. I have a 13-year-old, 10-year-old, and bonus, I got a 2-year-old. Been having kids for almost 2 decades. But anyways, I feel like the dynamic of our family is different from almost everybody that you know. So it's just hard to give anyone mom advice because I doubt you would take anything I say.
Hey, you make it work. And like you said, your kids are great. So that's, I guess, all that matters.
I think so too.
I guess I did okay.
Yes, I did. They didn't die.
Oh my goodness. So before we wrap up, do you have any final advice you want to give to people listening? We might even have some patients, non-dental people listening in at this point too. But is there anything that you'd like to say to people?
Yeah, just keep an open mind about things. Myofunctional therapy is not new. It's been around since the 1900s. And the fact that in the last 5 to 8 years, we are really more aware of this. Hopefully, it will start being incorporated in more dental schools and hygiene programs. And just airway health will be standardized care in dentistry or in any medical facility. If you can just think about, how are you sleeping? Do you know? How are you sleeping? How are you breathing? Breathing? No one's ever asked me that, but it is a real question that can just start a conversation on how the patient's feeling. Myofunctional therapy is, I think every single dental office should have 1 or 2 therapists. It is a life-changing health component that is unmeasured. You can't measure it. There's lots of studies that try to. It's unmeasurable. You feel amazing if you can just focus a little time on rehabilitating, getting nasal breathing. And then I really didn't talk about too much what myofunctional therapy was for some of your listeners if they didn't know, but then you really work hard at almost physical therapy for the tongue, lips, and face. That is just going to follow much nicer if we get the nasal breathing down packed in the first place. Being open-minded and giving your team, as you young dentists or whoever's listening, lift them up. And they can do amazing things if you give them permission. I think working in an environment like our office and the unlimited growth that the Thorpes instill on us always is one-of-a-kind place.
Absolutely. That was one of the things I wrote down going into this year, like our New Year kickoff meeting. I don't know exactly what the word was, but something along like unlimited potential. That's just like how you feel here. Like you could do anything. You can impact an enormous number of people. Like any opportunity is possible with being here, which is just so cool.
Yeah, I love it.
Thank you so much. I feel so grateful to know you as a person, to learn from you on a personal level, a clinical level. You've been such a great friend and mentor with me transitioning in these first months, and I appreciate you taking the time to talk on the podcast. I know it's going to help a lot of people.
My pleasure. Anytime. Anytime, Dr. Haley.
Yeah, and let us know. Jenny thinks she might want to start her own podcast. So if you think she should start a podcast, let us know, and eventually I can share it if she does.
Thank you so much.